Hi everyone, I wanted to do a brief video on a post I just did, which was on myositis. Specifically, I wanted to go over dermatomyositis, which is a condition where both your skin is involved and your muscles, and it's an inflammatory disease of your muscles. So what this means is that you have weakness in your muscles. So the proximal muscles, the ones that are closest to the trunk, so like the shoulder, girdle area, the hips, they feel weak. It's difficult to get up out of a chair. It's difficult to push yourself up out of a seated position. Walking up the stairs might be more challenging. So that weakness is due to that muscle inflammation, and that can cause you to have difficulty doing your day-to-day activities. When the skin, so that could be just the muscle involvement and the muscle inflammatory disease, but when your skin is also involved, then that's where we get the dermatomyositis. Whereas if it's just the muscles, we figure out what type of a muscle inflammatory myositis it is. So if it's dermatomyositis, you can have skin findings associated with it. Some people can have what we call a heliotrope rash, which is a rash around the eyes. You can have sun sensitivity, where you have something called a shawl sign over an area that you wear. The shawl would be more red and inflamed. You can have changes along the fingers and the knuckles, so along the knuckles here and here, as well as the further ones where you're getting it almost, they call it like mechanic's hands as well, when the sides of the fingers are involved and looking dry and cracked. So you can have all those type of changes going on with the skin. So when the skin and muscle is involved, and we usually test for that when we hear that a patient is weak and they're having difficulty with their muscles and having a skin rash, that's when we go and do some testing. We can order inflammation tests like the ESR and CRP are two of the big ones. I will order muscle markers, so CK, the creatine kinase, the aldolase, those are our muscle markers. And then you can have overlap of these muscle inflammatory conditions with autoimmune disease like lupus. So I usually will do initially the whole panel and evaluate as well, because some people can have something called mixed connective tissue disease, where you have an overlap between not only the muscle inflammatory disease, but possibly the dry eyes, dry mouth syndrome, so Sjogren's syndrome, maybe rheumatoid, and it might be lupus. So you can have overlap conditions as well. Then you also want to look for systemic involvement. Sometimes there can be interstitial lung disease, which is a lung disease that can be associated with this type of inflammation. So all of these things are things that we look for. When we get the labs back, if there's any abnormality, many times we send patients to neurology in order to have their muscles tested, and that's through EMG and nerve conduction studies. And then if there's an area that's looking particularly inflamed, sometimes a muscle biopsy is needed. And that way we can hone in on the diagnosis of the type of muscle inflammatory disease that's going on. If it's very clear cut and obvious, you don't need to go through all of those steps of muscle biopsy, but sometimes it's needed in order to decipher, is it an inclusion body myositis? Is it just a polymyositis? Is it due to a medication that you're on, such as statins can sometimes cause myositis as well? So these are all kind of things that we ask about and go through. And then depending on what the situation is for that particular patient, then we decide on what medications to use. So whether it be very mild, sometimes you can use methotrexate. Other times you can use Imuran, which is azathioprine, or Cellcept, which is mycophenolate mofetil, or sometimes Rituxan infusions are needed too. Also, many times in these patients, in order to calm things down right away, we need steroids because they work quickly and they work to calm down the inflammation. And then as we're getting on these autoimmune medicines, which sometimes take a bit longer to work. I hope this was helpful. I know it's a lot of information. I did a post on this as well. If you have any questions, please comment below.